Hello. Welcome to episode 6. We are back and excited to have a special guest on this episode today. My name for new viewers and to remind those who have tuned in is Dr. Lucretia Sewell, and I am the CEO and co-founder of Melanated Healthcare.
Hello, I'm Shermaya Holland, the CTO and co-founder of Melanated Healthcare.
Yes, and we are excited to introduce to you today a wonderful special guest that we have on, Dr. Casey Ann Collins. She is a provider who specializes in women's health. And today we'll be discussing breast cancer awareness and consideration of shedding light on this major issue that is really for the month of October. So nevertheless, Dr. Casey Ann, thank you for being here today.
Hello, ladies. This is such an important topic, so I can't wait to get into it.
Thank you. So with that being said, we'll go ahead and just start having this conversation, this important conversation. So what are the
common risk factors for developing breast cancer?
Several risk factors, definitely age. Advanced age can definitely play a role. You see in statistics, as we all get older, our immune system declines, making us more prone or at risk for certain diseases such as cancer. Genetics plays a huge role. We know as Black women, we're at least 40% more higher to be diagnosed and possibly even die from breast cancer. There's a whole study about epigenetics and how genetics from slavery, how it actually impacts us as far as our reaction to stress. So genetics plays a role, family history. If there's multiple members in the family that has been diagnosed with either breast or gynecological cancer, that's an increased likelihood to possibly have breast cancer. Testing for the BRCA1, BRCA2 gene. So if you have that genetic mutation, that's also a particular risk factor. Lifestyle is big, and I feel like lifestyle is something you can actually modify. But drinking excessively, smoking, being overweight. There's studies that have linked estrogen to breast cancer because high levels of estrogen leads to cell replication or the cells multiplying over time, leading to abnormal cells. So definitely, just monitoring weight, being at a healthy weight is important as well. Avoiding stress. Again, stress can lower the immune system and that can lead to the likelihood of breast cancer. So lifestyle, age, genetics for sure, medical history. If you're on chemotherapy drugs or if you are immunocompromised, that can also lead to a higher risk or a risk factor for breast cancer.
I also have done some studies of my own because this is near and dear to me because it is something that's a part of my family. I've lost individuals on both sides due to breast cancer. And so what's the likelihood, or do you see that when breast cancer develops in one breast, does it increase the risk of getting breast cancer in the other?
Great question. I don't have the exact number. Obviously, when there's breast cancer, one breast, usually diagnostic testing will test for both breasts, whether that's with a mammogram, diagnostic mammogram, or an ultrasound. It doesn't necessarily mean you will have it in your right breast. It depends on if it's spread to the lymph nodes and things like that. But that's a great question.
So this is a fun one that we get to ask you. I always get this question, like, how often should I be performing the self breast exams? So the USPTF has some sayings and some of this. So just share with the public those recommendations, if you will.
What I tell my patients, obviously, every month. So it kind of depends on if you're menstruating or not menstruating. So if you're a menstruating woman, you're still having your cycles, you should definitely be checking your breasts every month. Things can change from month to month. I usually recommend my patients to not perform a self-breast exam when they're on their cycle. It just makes it harder to detect lumps. Your breasts are more than likely tender, so you don't know if that's normal or not normal. So usually I recommend my patients to do a self-breast exam about 5 to 10 days after they've had their cycle, but try to really stick to that same time every month. If a woman is menopausal, that's different. She should definitely be doing it the same time every month, whether that's the 1st of the month or the 15th of the month. but I recommend every month, whether in the shower, in front of a mirror, laying down with the arms up, a breast exam should be done so you can actually detect normal from abnormal.
I think you touched on this a little bit as well, this next question or bullet point here. So lifestyle changes to decrease the likelihood of breast cancer. So I know you said alcohol consumption was one. Is there any others that you would recommend? So alcohol consumption, I heard you talk about obesity.
Wow. Smoking again can lower the immune system. It can activate cancer cells. It's not good for you overall. So definitely smoking. We spoke about obesity and that link with just various cancers. And there's plenty of cancers that are actually obesity driven. So this is why it's important. And it's not about aesthetics. It's not about being skinny. It's really just about making sure we decrease that unwanted estrogen level. Sure. You mentioned stress. I think again that's super, super big when it comes to just our immune system and our overall health. But I would say, those would be the main one aside from other things like being exposed to radiation and things like that. There was also one study that actually looked at menopausal women, so late onset menopause. So if you have long exposure to estrogen, that's also been linked to certain types of breast cancer as well. So if you enter menopause later, that can increase your likelihood.
So just again, why is it so important to raise awareness about breast cancer beyond just this month of awareness? Like, why is it so important to shed light on this matter?
Yeah, I mean, it speaks for itself. And women get diagnosed with breast cancer every day, every month, not just obviously in October. So I think it's important to spread awareness, one, about the disparities, two, the signs and symptoms, three, because early detection really does save lives. So if you're checking yourself or something's out of the ordinary and you go and see a provider, that could be a difference between stage 1 or stage 4 breast cancer. So I think, we should talk about it all the time. Men can also get breast cancer as well. So it's a discussion that definitely should not be, not talked about.
For sure. Yeah, so that leads us right into debunking some myths in regards to breast cancer. And I think that you definitely highlighted one on the tail end of the last question is men developing breast cancer. So most of the time we just think about women developing breast cancer, but you spoke to men also developing breast cancer. Any light you want to shed there?
Definitely when they go in for their physical exams, make sure that's an area that's being checked as well. I remember working in primary care before I transitioned to women's health, and that was actually something I did. And people looked at me like I was crazy, but I was like, this is important to do. So I think men should also engage in that, or at least be more in tune with their body, for sure.
That's definitely. And that is also a risk factor. If you do have a male person in the family that has had breast cancer, like you said, the genetics, you certainly want to make sure that you are getting screened, especially if it's a male relative. But yeah, very much so true. Any other myths that you want to shed light on, Casey, that you've heard of in practice and was just like, what? Like, where did you get that information?
There's so many. I would say one that's interesting and actually very dangerous. Oh, breast cancer doesn't run in my family, so I can't get it. That's a huge, huge myth, unfortunately. So oftentimes, if someone does get a diagnosis, it's like, well, I don't know of anyone else in my family, but it depends on lifestyle, were you exposed to something, or sometimes it can just be by unfortunate chance. So this is why like self-breast examinations and kind of knowing your body or coming in sooner to see a provider is super, super important. So that's a dangerous myth, actually. Some silly myths, I would say more so, is more like, breast cancer can be caused by the underwire in my bra. And I'm very big on science. I'm very big on clinical studies. There just isn't a strong correlation between the underwires in your bra. If you do have a bra that's not fitting you well, change it. But I don't think that that's necessarily going to cause breast cancer. Number, I guess, 3, especially within our community of color, there was a study with the relaxers. And I don't want to say that it's not possible. I understand where they were going with that. And I think that's just harmful to you, the lie and a lot of products. Anything that's going to compromise your immune system, you should stay away with it. The deodorants, that was another subject with the aluminum. Again, if you want to be all natural, I encourage it. I think the more natural you are, the better, especially if there is an increased likelihood of breast cancer in your family. But there isn't strong clinical evidence for underwires, for the relaxers, as well as for certain deodorants.
Absolutely. Anything else?
What about mammograms and it being exposure to radiation there? I know I've heard a lot of friends and family, they're like, oh, I don't want to get a mammogram, one, because it hurts.
You're unpleasant.
They say, is the radiation levels dangerous enough? Or is that just really considered a myth?
I would say that that's a myth based on clinical evidence. I would say, number one, it definitely depends on the age that the family member was diagnosed. So, for instance, if my mother was diagnosed with breast cancer at age 40, they used to screen 10 years earlier, but now they're recommending at least, 5 years earlier. And this is important because then we can actually detect things earlier. Obviously, if I'm very young, I'm not going to continue to do that consecutively year after year. That's a lot of exposure. And I understand that that's a concern for a lot of my patients. I'm being exposed to radiation. Can I just do it in another 5 years? But then it kind of makes it hard to detect something. So I would say a yearly mammogram is usually recommending once you're at least over age 39, or depending on the diagnosis of a relative that was diagnosed with breast cancer. But you should be getting yearly mammograms because they save lives, especially if you have dense breasts. And again, when it comes to us women of color, we tend to have denser breasts, so it's important.
Dr. Casey, can you explain what dense breast tissue means for the folks? They may not know.
So for dense tissue, basically like within a mammogram or a diagnostic test, it can make it harder to detect abnormal cells or lumps. So even if you're doing a breast exam, you may not easily be able to distinguish normal tissue from abnormal tissue. And again, this goes back to genetics. We just are more prone to denser breasts. So we should always get a mammogram as well as an ultrasound. Ultrasound looks at superficial tissue, and then mammogram is looking at deeper tissue. So dense breast is definitely something that can sometimes actually be a risk factor for breast cancer. So we need to be aware of that.
What do you tell your patients with dense breasts when it comes to doing self-breast exams? I know in practice I get this all the time. Like, how do I know? Like, what is your technique? Like, what is your word of advice for them when they're doing these self-breast exams with really dense tissue?
Definitely everything we spoke about, standing in front of the mirror, looking for asymmetry, looking for lumps, any changes on the skin. But I would say more so putting the hands on the hip, kind of coming forward, because then you can actually see any separations from the breast tissue if there is a lump there. That's one of my methods for it. Obviously, also applying pressure, light, medium, and deep. But I would say for the most part, I'm sending them for a mammogram or an ultrasound. But definitely, I think coming down this way would definitely help. As far as just separating the tissue, because not every lump can be seen laid back or which are easy. What do you recommend?
The exact same thing, honestly. And then I also, in practice, I recommend them drawing like the areas, like 2 circles, like just like a diagram, and to actually mark where they notice the dense tissue so they won't have anxiety from month to month when they do come back. Say that it is a time difference when they're doing this exam and they have those changes, as you expressed earlier in this talk, and they're just like totally like worried about it. So to decrease their anxiety, to decrease the worry, like you can refer back to this image that you drew the month prior to know, yes, I did notice that this area was dense last month, that is consistent, and there aren't really any changes in this area. So it's for my people that are kind of more anxious about it, maybe for whatever reason, like just to relieve that anxiety. A lot of times I'll tell them to do that as well to relieve that.
That's a great idea. That's a great idea.
Thank you, girl. Like we can help each other. Yeah.
Well, is there any other items or things that you want to express in relation to, breast cancer awareness month before we talk more about just who you are and your story and your journey?
for young females is to definitely start checking their breasts. I have seen a trend, at least within Long Island, where younger females are coming in and being diagnosed with breast cancer. So they may come in just to get their birth control refill. And at our practice, we make sure we always do breast exams because they're on hormonal therapy. And there will be a lump. Sometimes they notice it, sometimes they don't. And it will come back as invasive ductal carcinoma. So I think for us, just as providers or just within the community, to not dismiss someone because they're young and they have a lump, to necessarily think that, you know what, it's not something dangerous. And also on the flip side, to also understand that every lump does not mean cancer. Sometimes it could be a fluid-filled cyst or a fibroadenoma, which is like a benign cyst in the breast. So I think there's like a fine line between, oh my God, I have cancer, to, oh, she's too young, she probably doesn't have cancer. So I think we need to be a little bit more self-aware.
I like that you said that, because I know I went a while ago and they're like, well, you're too young to do this. And I'm like, I don't feel like I am, just because there is family history there. But I think a lot of doctors do, they miss that fact that, you know, just because you're a certain age doesn't mean that something's not there.
Access to healthcare, because that could be another factor why someone was diagnosed with breast cancer very late. I know the Coleman Foundation has created a whole bunch of laws and acts that literally protect patients who were diagnosed with breast cancer to have free access to healthcare, or to get breast cancer screenings free of charge, or to be reimbursed. So there's so many acts in place now because we want to decrease this breast cancer statistic. So patients are protected, and I'm so happy about that, because I lost a grandmother to breast cancer, which also then became cervical cancer. So I'm big on that. Like, I'm super passionate about it. Yeah.
Well, if we don't have anything further, Dr. Casey Ann, I just want you to share, like, what drove you to this specialty, from primary care to women's health? Like, where did that passion come from? What was your journey like, your transition like? Just share with the people how wonderful you are.
It's an ironic story, because I did not want to go into women's health. I was that girl in clinical. Yep, exactly. I wanted nothing. I was like, babies, GY. Nope, want nothing to do with it. I was a derm girl. All about, you know, I worked in derm when I was an RN for many years. That was my thing. I was like, I'm going into derm. Graduated, and the practice I was supposed to work for, basically the provider didn't want to pay me what I was worth, and then he was basically packing up and going to another state. So I was kind of like, that's where I had, you know, all my hope. I was going to work at that derm facility. So where I'm working now, I actually did my clinical rotations there, and they asked me to work a couple of times. They're like, "Come, you're really good." I'm like, I want nothing to do with it. Absolutely not. And then my mom, I think we were having a conversation about my grandmother, and she was like, "You should try it. You should go into women's health." And I was like, "No, Mom, I don't think I want to do that." And she was like, "You should try it." She was like, "I'm telling you, it'll be good for you." And here I am. And, you know, the biggest thing is that I guess I realized that my purpose was intertwined, was when I would walk in, especially seeing women that look like me, or just the breath of fresh air. They're like, "Oh, thank God, as a sister." But even though I felt proud, then it was also sad for me, because I would just think, why are you saying that? Like, what experiences have you had that make you hope and fret that I hope a sister walks through the door? And that's when I was like, okay, there's a need. We need to change this. There's a lot of disparities in women's health that I actually was unaware of. The maternal death rate. You know, we spoke about with breast cancer, how we have more aggressive forms of breast cancer, just how we're neglected when it comes to just care in OBGYN, and that dates back to slavery. So then it became different. Then it became, okay, you have to play your role, your small role, in making sure that you are the change that you want to see. So that's how, like, women's health then became like, okay, it's this is passionate now. This is that needs to be done. But I was unaware of it, because even when I learned in grad school, we learned the basic etiology and physiology, but I didn't know about the disparities. So that was the issue. Yeah.
I'm glad that you brought that up, because I do often tell people that aren't in the healthcare space, like, as far as our curriculum, they don't really, it's so not included. Like, it's insane until you get out into practice. You don't really feel it in such a way and realize that such a disparity exists. And you hear it from your patients time and time again, day in, day out. And like you said, that relief when they do actually see us come to the door, like, thank God, or whatever higher power they serve. But you know what I'm saying? Like somebody that can hear me, somebody that can see me, someone that understands from this perspective. So, and somebody that I can probably trust. Like it makes such a difference. So thank you for.
Like, that's how serious it is. Because as you just said, you really do feel seen. And I feel like for Black women in certain spaces, and things have gotten better, we weren't being heard. Our pain was being ignored, whether we were pregnant or whether we were not pregnant. So I think so much needs to change. But there's, us, who are spreading awareness. And I think just being at the forefront of healthcare, we're making a huge difference.
Most definitely. Well, where do you see yourself next in this whole field, like as far as women's health? Because I mean, you've been making an impact, and I love to see it from near and far. But where do you see yourself headed next? Like, are we doing research? What's on the radar?
Definitely, for sure. But I'm big on my medical mission.
Mm-hmm.
Definitely doing my work here, but I feel like my calling is also overseas. So just going to areas where they really, really need it. I went to Nigeria this summer, and there were females that were just happy just to get a breast exam. They were just so grateful because they, when they had lumps, like where I know. So I think that has definitely become my passion. Obviously, every time I go to a country, I know there's more work that needs to be done, but I think that's where God is drawing me. There's so much work to be done here in the States as well, and I would love to do other things, but I'm trying to just one day at a time, and I'm getting better about that, and Black women need rest too. Not too many things on my plate. Yeah, because that's always a question. But I'm like, sometimes there's no what's next. Just right here is good for me.
Right now.
Yeah.
Yes.
I'm like, right here is good. Yeah.
I love it.
I love that.
Well, do you have anything else, Jeremiah, that you'd like to ask Dr. Casey Ann?
No, just anything else that you would like to talk to the audience about. I think the work that you and Dr. Lucretia Sewell is doing is fantastic. I've never had a Black OBGYN, honestly. And so to see and know that this type of work is happening, it's just fantastic. But is there any other items that you want to talk about?
Everything you do, but Melanated Healthcare, first of all, amazing. And
Thank you.
Think about it, and it's important that we need more organizations or just everything you're doing behind the scenes in the community like this. So no, thank you, ladies, so much. Thank you so much for having me.
Yeah, grateful for you and your work, and obviously being here. We're just thankful for the people like you that truly care and know the importance that we have in the lives of that we encounter. So with that being said, I guess this pretty much wraps up our discussion on breast cancer awareness, a little bit of women's health in the mix, and
all the great work Dr. Collins is doing.
Yes, all the great work Dr. Collins has done up in New York and beyond the borders. So she's an amazing woman. So thank you for being here.
All right. So thanks for joining us today. Don't forget to subscribe to all our social media platforms. I think we're on every platform that's out there. Like, share the video, please leave comments, give us your feedback, ask questions, and we'll see you next time.
Yes. Bye, guys.